How to administer the correct dosage of emergency seizure meds. When a seizure lasts longer than 5 minutes or happens in clusters, quick action can make a big difference. Knowing how to give emergency seizure medications safely and correctly is essential for protecting someone during a seizure. These medications, often called rescue drugs, include options like benzodiazepines, which work fast to stop prolonged seizures. The right dose depends on the person's age, weight, the specific medication, and how it's given. Always follow the instructions from a healthcare provider or a personalized seizure action plan if you have one. First, identify which medication to give and how it's administered. Emergency seizure meds come in different forms like rectal gels, nasal sprays, oral dissolving tablets, or injectable solutions. The route you choose depends on the person's age, ability to swallow, and what's available. For example, rectal gels like diazepam are common for young children, while nasal sprays like midazolam are often used for older children and adults. Next, determine the correct dose based on age and weight. For children, dosing is usually calculated per kilogram of body weight. For instance, diazepam rectal gel is typically given at 0.5 milligrams per kilogram for children aged 1 to 5 years, with a maximum dose of 20 milligrams. For children aged 6 to 11, the dose is about 0.3 milligrams per kilogram, and for those 12 and older, it's around 0.2 milligrams per kilogram, with a maximum of 20 milligrams. Midazolam nasal spray is usually dosed at 0.15 milligrams per kilogram for children, while adults often receive a starting dose of 5 milligrams, which can be repeated if needed. Lorazepam, another rescue medication, is often given at 4 milligrams intravenously for adults or 0.1 milligrams per kilogram for children, with a maximum of 4 milligrams. Use the proper device or formulation when administering the medication. Prefilled syringes, nasal spray devices, or oral dissolving tablets all have specific instructions. Make sure to follow the manufacturer's directions and your healthcare provider's guidance for accurate administration. Administer the medication as soon as possible after the seizure begins, especially if it lasts longer than 5 minutes or if the person has a history of prolonged seizures. Prompt treatment can prevent the seizure from worsening or causing injury. After giving the medication, closely monitor the person for signs that the seizure has stopped. Watch for side effects like excessive drowsiness, difficulty breathing, or low blood pressure. If the seizure persists despite the medication, or if side effects become severe, seek emergency medical help immediately. Even if the seizure stops after medication, it's important to follow up with a healthcare professional. They can evaluate the situation, check for underlying causes, and adjust the treatment plan if needed. Always have a seizure action plan that details the medication type, dose, route, and when to seek emergency help. Caregivers and family members should be trained in how to give emergency medications correctly, and medications should be stored in an accessible place. Regularly check expiration dates and replace medications before they expire to ensure safety. Remember, never give more than the prescribed dose unless instructed by a healthcare professional. Do not give oral medications if the person is unconscious or having trouble breathing. If the seizure continues despite emergency medication, call emergency services immediately. Always consult a healthcare provider before making any changes to the medication regimen. Properly administering emergency seizure medications involves understanding the person's needs, following precise dosing guidelines, and acting swiftly. This careful approach helps keep everyone safe and ensures the best possible outcome during a seizure emergency.